Federal workers are being laid off. Headlines scream that Social Security payments might stop, and panic is spreading across TikTok and cable news. But the truth is more complicated. Before you start worrying about your next check, take a breath. The sky isn't falling, but parts of the government are definitely shaking. What's happening now is a reshaping of the federal workforce that will touch millions of Americans in indirect, often invisible ways. The layoffs won't stop payments, but they will slow the gears that keep them running smoothly. Let's start with who's actually being laid off. According to a leaked Office of Management and Budget (OMB) list, 5 major departments are seeing the first wave of cuts: Treasury, Health and Human Services, Commerce, Education, and Homeland Security. Notably absent is the Social Security Administration, SSA itself. That's because Social Security is funded by a permanent, automatic appropriation. It doesn't rely on Congress for its regular checks. That means the 62 million Americans already receiving retirement, disability, or survivor benefits will continue to get paid exactly on schedule. The money is pre-allocated, and the computer systems that handle those deposits at the Treasury's Fiscal Service run automatically. Even if the offices are half empty, the code keeps sending out payments. But here's where the real pain begins: the waiting rooms, not the mailboxes. If you're already receiving benefits, you're fine. If you're applying, appealing, or updating anything, you're about to hit delays. Think of it like an airport where the planes still take off, but they just fired half the TSA agents. New applicants turning 62, people appealing disability denials, or seniors replacing lost Medicare cards will find themselves waiting months longer. Disability Determination Services, DDS, which processes medical reviews for disability claims, is run by the states but fully funded by federal dollars. Since that funding is now frozen, the system is stuck in neutral. The average wait time for a disability decision, already 7 months, could stretch close to 10. Meanwhile, Medicare is facing its own quiet threat. Social Security checks are legally protected, but Medicare isn't. The reason lies in an old law called PAYGO, or Pay-as-you-go. It automatically triggers spending cuts whenever Congress passes laws that increase the federal deficit. Social Security is exempt, Medicare is not. With recent tax breaks and deficit hikes, the Congressional Budget Office projects over $500 billion in Medicare cuts over the next decade unless Congress steps in again. That could mean fewer doctors accepting Medicare, more pre-authorization rules, and shrinking Advantage Plan networks. Some seniors are already receiving letters saying their plans are ending next year. The situation is worse for Medicaid. Because it's funded jointly by states and the federal government, the squeeze hits faster. Budget clawbacks totaling nearly $900 billion over 10 years are already forcing states to disenroll people for paperwork reasons. In many cases, recipients are still eligible, they just missed a confusing letter or form. Utah's audit found 9 out of 10 people dropped for Medicaid still met the criteria but couldn't finish the process in time. That's why advocates are warning seniors and low-income families to open every piece of mail that looks boring, because buried in those envelopes are the forms that decide whether your coverage continues. The ripple effects extend beyond healthcare. Veterans Affairs hospitals, Section 8 housing, and food assistance programs are all feeling the cuts. The VA isn't on the layoff list, but earlier administrative efficiency orders have already eliminated thousands of clerical jobs. Some VA clinics are now sending automated messages telling veterans to expect delays of up to 7 weeks on claims. At the same time, housing vouchers under HUD's Section 8 program took a 43% budget reduction, and new time limits for able-bodied recipients are creating confusion. Older and disabled residents are supposed to be exempt, but with fewer caseworkers, those protections are only as reliable as the next overworked staffer who updates the file. So, what can you actually do right now? If you're already getting Social Security or SSI benefits, don't change anything. Your money will arrive just like always. If you're about to file, set up your My Social Security account this weekend and download your earnings record before the site gets overloaded. If you're waiting on a disability review, send updated paperwork immediately. Cases are processed first in, first out, and fresh documents can help your claim avoid the bottom of the pile. For Medicare open enrollment, treat it like a sale day. Compare your current plan, doctors, prescriptions, and costs before switching. If your Advantage plan is being discontinued, you have a short 63-day window to purchase a Medigap Plan G policy without medical questions. Miss it, and that guarantee disappears. If you're a veteran without Medicare Part B, you can still enroll between January and March, but each year you delay adds a lifetime penalty. For Medicaid, if you get a termination notice, appeal within 15 days. You keep your coverage during the appeal, and most who appeal win. The system may be chaotic, but there are still ways to protect yourself if you act fast and know your rights. The politics behind all this are predictable. Every administration, regardless of party, leans on buzzwords like fraud, waste, and abuse to justify downsizing. The problem is that these slogans distract from the reality that most of the federal budget is already efficient. Social Security, for instance, runs on just 0.4% in administrative costs, lower than any private insurance company in the world. The cuts aren't really about efficiency. They're about making public programs so frustrating that privatization starts to look appealing. Wall Street has long dreamed of skimming even a small percentage of the trillions in payroll taxes flowing through the system. Weakening the workforce that administers it is the first step toward that goal. So, here's the bottom line. Your Social Security check will arrive, but the system around it is being hollowed out. The damage won't appear in your next deposit. It'll show up when you need a form processed, a call returned, or a claim approved. The workers who make those things happen are being told they're expendable, and that means longer waits and more red tape for everyone else. If you depend on these programs, don't panic, but do get proactive. Save your records, double-check your accounts, and set reminders to follow up on any application.